milestones that you are trying to set
national social security information
and that the both parties agree on.
Learn how to diagnose people better
On a more realistic timeline.
Hi everyone, and welcome to this chapter around business models for digital healthcare in Austria. My name is Sabrina Lagoon. I am the program manager of Hub Vienna, and I will walk you through the basic principles of basically how to make your startup work in the field of digital health in a very special healthcare system, and I will walk you through it. As you know, each country has its own healthcare system, different players, different providers, and today we will try to dig a little bit deeper into what is going on in Europe in general, in Austria in particular, and how can you actually find someone to pay for your solution. So, as you know, in Austria we have, let's say, a healthcare that is free and accessible to all, where you basically, when you start working at a job, or if you register as self-employed, you get a e-card, which is kind of a credit card or a bank card that you can use to identify yourself with your social security number. Whenever you take an appointment at the doctor, whenever you go to the hospital, you need to do an x-ray, then you would present your card and you don't have to give any money. The treatment will be kind of free of charge for you. Obviously, it's not really true. Somebody has to pay for it. It is funded by taxpayers. And so it goes like this, that whatever income you make, there's a certain percentage of your income that is going to contributions for a social system. And this social system is taken approximately, so you as an employee would give 20% of your income to this contribution, and your employer would add another 20% on top. So we are around 39% contribution taxation level. On this end, of course, it's not only covering healthcare, but also your retirement in case you have an accident, or an accident happening particularly in the workplace. It is covering also your unemployment benefits in case you lose your job. This is, of course, very important, because the money that is taken from your salary or from your income goes to different pools, to different social institutions. We call them Kassa, which means basically a money box. And there are multiple of them. I will not go into the very detail, but you can imagine that there's something that takes care of retirement, another one that takes care of elderly care, and others for employed people, other for self-employed people, and some special Kassa for public servant and railroad workers. Of course, once again, this contribution is capped. So if you make more than 6K per month, then whatever you make above, the amount of social security contribution will be the same. So this is proportional to your income, but with an upper cap, in order not to discourage people, and in a way that it's still worth it for everyone to participate in the system, no matter how wealthy you are or how poor you are. And if you make under a certain amount, of course, the contribution might be also adjusted. So this has a lot of course, positive effects. And so the pros are that the most excellent care from top research institutions are accessible whether you are poor or rich. And if you have a very dramatic shift in your life, for example, you become handicapped or you have a cancer, this will not mean that you have to be financially ruined and you can go on with your life correctly. A lot is included. So it would include prevention, for example, a yearly blood work to check if you have any ongoing illnesses that don't have any symptoms. This includes a yearly teeth cleaning that is covered to a great extent by the Social Security. And any heavy situation you might need to go through, so chemo, transport to the hospital, and many other quite costly procedures that, for example, in the US or in Asia might not be covered. The Social Security also pays for sick leave. So after 1 month of illness, it's not the employer who covers your income anymore. It's the Social Security that guarantees you almost the same salary, netto salary, for up to 1.5 years of sickness. And so this is great because the employer is not covering the risk of you becoming sick, but let's say this is a society who takes over it. Maternity leave is also covered up to 2 years, and in general, as a mother, you have a few years of maternity leave, and when you come back, you're also allowed to be working only part-time. And the conclusion is that the model is, of course, bringing everybody to pay, but would make that if you have a healthcare event or an accident, you have this safety net that does not need to lead to a dramatic change of your life. So it's not going to turn your life upside down. So of course, not everything is all pink and beautiful. There is not such a strong two-speed healthcare system as in other countries, but still having connections, knowing someone, the brother or the cousin might get you an appointment earlier. Because specialists are covered by the Social Security, then much more people are getting care, and there's always a lack of doctor, which means that you might have to wait for a very long time to get an appointment. At the moment, the mental health is not fully covered by the Kassa, at least not for all of them, and so this is still a huge unmet need. There is no clear path at the moment for digital health solution reimbursement, although this is something that is being very much discussed as we speak. And of course, this is more of a philosophical question, but you cannot opt out of this scheme, so basically everybody has to do it. What does this mean? This means that around 1/3 of the Austrian population is paying extra for a complementary health insurance that allows you to have care that was maybe not deemed necessary by the public taxpayer, because the interest of the taxpayer is to keep the costs low. So if you pay for private insurance, you might have, for example, a separate bedroom in the hospital. You might have access to certain apps that keep you healthy, something that will not be typically part of public social security. And so the economical aspect of it is quite interesting because you go towards different mindsets. So the doctors will accept the Kassa, which means the payment of the doctor, how much a doctor makes, is determined by these Kassa, by these social security standardized fees. And so if you're a doctor and you want to earn more, you have to kind of get out of this system and become a choice doctor, so a doctor by choice, someone that you would pay privately from your pocket, typically more money, either because they want to make more money, or because they want to use new tools or new machines that are not going to be, let's say, standard and that might be a bit more expensive. And so a private insurance allows you to have access to these private doctors. And thankfully, the Social Security still covers a bit for you. It covers 80% of the standard rate of a regular doctor, so you can, one that accepts the normal fee. And so you can still go for a private doctor. And you would pay part of it from your pocket, and the rest, what would normally be paid by the Kassa, you'd get 80% off. I hope this was clear, but you understand a little bit the different incentives and the different mindsets of, let's say, healthcare practitioners and healthcare systems. So we are now talking about a healthcare system of compromise. I will go a bit more in detail later, but to be brief, despite the small size, Austria is very regionalized. So the regions have a lot of local power, and I'm not going to go into historical details. Recently, there was an effort in fusioning and collectivizing the resources of these social securities and federating them. However, you have to keep in mind that there is a culture of compromise which leads to very slow decision making. And so you have to imagine the healthcare system as a slow but stable process in Austria. So I would say let's go through the stakeholders one by one. And first I would like to talk about the industry. So corporates are quite of a big driver of digital health innovation in Austria because it's private money mostly. So you would look at the pharmaceutical industry, for example, which is a very strong industry in Austria, with some of the pharmas doing R&D here and others focusing on manufacturing and sales. In any case, they have been, and also through our program, quite active in testing different digital health solutions and might be a great partner to start talking to when designing your approaching of European and Austrian healthcare sector. And so you have then, of course, the insurance industry, which has, as I already mentioned, quite a strong interest in providing a bit extended offer for private clients. Of course, the telecoms, the IT sector, management consulting are all very interested in digital health. Because of the very public and taxpayer-driven healthcare, going from a pilot with the industry to really scaling up nationally would really require a strong business model. Because of course, if the pharma pays for 1 or 2 years and then no one else is here to pay further, the project might die. The public sector has also a huge interest in startups doing business in Austria and bringing more innovative ideas. And so you might find help in institutions such as the Business Agency or the Chamber of Commerce, as well as many other networks such as Hub Vienna, Hub Vienna, Women in Health IT, many networks that have quite strong ties with the public sector as well. So as you know, we also have a public education system, meaning that our universities, particularly to train medical doctors, is free, or rather 20 euros per semester for European Union students and around 300 to 400 for international students. So we're really looking at doctors that when they are starting their career do not have such a huge backlog of debt like in the US, for example. So we are really undergoing very different financial incentives when it comes to research in public institutions. Typically, hospitals is where most of the medical research is going in terms of clinical research. And this is where you have the most chances to be running clinical trials. Medical research is very strong in Austria, as well as life sciences. And there are a lot of opportunities to collaborate, particularly on clinical settings. When it comes to usability or product testing, then we would advise to also look at private hospitals who usually have a bit more business incentive to collaborate and who might want to try out your solution. In terms of financing, there is, of course, venture capital funds, family office, and many other private equity incentives that might invest into your company. But I wanted to draw your attention on funding, on grants coming from public players once again, particularly the FFG, who is typically funding R&D collaborations, most particularly between research labs and startups or inside of a startup, so to really push forward one innovation project. And of course, there is the AWS, the Austria Wirtschaftsservice, the Austrian business service, who is also providing funding. So what works and what doesn't work in Austria, I think you might have understood it from what I've mentioned to you. People pay a lot of taxes to get all of their healthcare for free. They might pay a little bit extra premium to get a private insurance. And overall, they are not used to spend money as a B2C as a patient for a service. And so you have to imagine that it is much easier for you to look towards other avenues unless your your service is really something that will change their lifestyle, that is really engaging, that provides them a new sense of self, or if they are dealing with a very chronic condition, then they might be considering to pay. But typically, B2C is not the main business model to go for, particularly because of this very, very safe healthcare system. If your B2C startup has a relatively low cost and is scalable, this might work. Or if it adds really a huge added value, something that they could not find in the public system, something that they could not find paid by an insurance. Otherwise, the best way to go is B2B2C. So you would talk to an insurance and the insurance might provide it in a bundle with other services as part of one of their premiums. Now, data as a business model. Wow, this is a really tricky one. Selling somebody's data is extremely regulated under the GDPR, the General Data Protection Regulation, which is a European-wide regulation. So whether you want to do business in Austria or any other European country, you really have to look into this. Whatever kind of business you're doing, even if you have an ice cream truck and you have, benefits program, you have to be GDPR compliant. This can lead to huge fines and huge issues, and also to break the trust of the Europeans. If you're not sure if your business is GDPR compliant, you can have a look at the other video focused on regulatory or ask us for help. On top of that, so even if a solution is GDPR compliant, there is still a huge gap in terms of culture between Austria and the rest of the world. For example, employees are very wary of their employer accessing or having any insight on their health data. And data as a business model for healthcare overall is something that you have to really carefully consider, particularly in your outside communication, because there really is a culture that is very different when it comes to privacy. A lot of people like to pay by cash. People don't like to have their data out there. So if you want to go and sell to doctors, you really have to understand their financial incentive. So the doctors, typically, they're the ones that are working with the Social Security. Their payment is actually limited by what the Social Security will reimburse per act. And so the purchasing they will have to do would have to kind of remove a pain point for them. For example, they want to do less paperwork, or they want to have less time for reporting to the insurance, or they want to simply have more time for the patients. However, if you're talking to a private doctor who is anyhow going to charge way more for their services to the patient, there we're talking about having a service that could be part of explaining the price point of these private doctors who can charge 300 per session, for example, and then it would make more sense. So you really have to go and think about the incentive of the doctor, how much percentage of private doctors are there in this specific specialization of medicine, and to really understand the dynamics of the business model. When it comes to the Kassa, so to the Social Security, here their incentive is to, of course, have enough good care for everyone, and they will reimburse something if it makes sense to the taxpayers. In fact, if it's something that could, avoid death or avoid a long illness. But whether it comes to compounds or any sort of treatment, there will really look into kind of the community before looking at, if it improves a little bit the accuracy. And so we are really looking into very different effects. So from the point of view of the patient, where we are really into improving the value of the service for the patient. And when we're talking to public players, where we have an absolutely different mindset. Of course, without knowing your solution in particular, it's very hard for me to advise you on the business model you should choose when entering the European/Austrian market. But typically what works the best, or let's say what is a safer bet, is to go for B2B2C, where you will brand your your solution for the private insurance industry that they can add as a service into their bundles. You might talk to the pharmaceutical industry, who is very eager to discover new solutions, and who might use it, for example, to monitor biomarkers during a clinical trial, or to learn how to diagnose people better into the population. Another business model that has been quite successful was, for example, during COVID, using symptom checkers or whatever biomarker in order to do triage in the AR, particularly for private hospitals. So here you have 3 examples. So pharma collaboration, bundling with the insurance industry, or having some private hospitals, so helping the processes of medical care into hospitals. These are business models that are working quite nicely in Austria. Obviously, it's really, really hard for me to give you personalized advice through a digital course, but I hope that you understood a little bit better the dynamics of who pays for what in Austria. There is no proper digital health app reimbursement framework right now. It's being discussed as we speak in 2021, but there is not a clear path like it could be in Germany. I hope that this mindset of the patient, the mindset of the doctors, public-private, and the logic of the payers of the institutions could be made more clear to you. Of course, if you have more questions, we're always here to answer. Thank you very much.